The main way right now that we distinguish, are they progressing due to, true progression and it's a problem versus, well, this is just how the drug works, is really how the patient's doing. If the patient is clinically otherwise well and their disease is getting a little worse, then we allow those patients to remain on for another cycle. Certainly, if that patient's disease continues to get worse, even if they're feeling well, I wouldn't keep them on the drug. Now, if the opposite is true and their cancer is getting worse and they're doing poorly, either significant weight loss or they're starting to have pain where they didn't have that before, then that's the time to bring the patient off of that drug and start another type of therapy if that's possible. So it's really how the patient is doing is how we decide whether or not to keep the patient on and be willing to wait to see if a patient will respond to that. But you have to remember, not all of these patients, if they respond, is it that progression and then response. It's a minority of patients that it actually happens.